All my life, I always wanted 2 kids. And I told myself, I'll get 2 children, regardless of whether they are male, female, I didn't care. When my son was born, he presented some symptoms which were not making sense. He was jaundiced, and he was also very weak. So we took him to hospital, and the doctors also realized that he was anemic. At that point is when one doctor came in and she asked for sickle cell test. And that was the beginning of the journey.
We have challenges because if you look at the number of babies that are born with sickle cell across the world, you have more than 70% of them being in the sub-Saharan Africa, and this is a great burden to us.
When you were given that diagnosis, what were you thinking?
Death. I was scared. I remember holding my son in my hands, and I started crying. Most of the time, the conversations would be somebody living with sickle cell anemia would never live to see a certain age. And that was what hit me first.
In a sense, that the inequity that has affected people with sickle cell disease is an example of the broader inequity that affects people who do not have the resources or who are unfortunate to live in places where resources are strained.
Really, the challenge in sub-Saharan Africa is that the health systems are weak and there is no coherent plan to strengthen the health system in a coordinated manner.